Okay, this is a chronic cystitis patient. When I look the trigone area, these are all abnormal tissues in the trigone. I can see the changed tissues. I can say these are in between logoplegia and trigonitis. There are plaque-like tissues here. And this is right ureteric orifice and left ureteric orifice. The side walls seems healthier. Still there may be some membrane-like issues. Okay, and in the opposite wall, this area, look, there is a beginning of inflammation. It is spread from this area to that area, I think. When I empty the bladder, we will see if they will come into contact. Now I am emptying the bladder. This area is more reddish, and as you see, it will come into contact. It is landing on the trigone. So it is just, they come into contact with the trigone area. This opposite side, I am filling it again, filling the bladder. Look, this is trigone area and this area is affected because they are in touch. Okay, so rest of the bladder, I want to say healthy, although it's not too healthy. I can see very nice white bladder mucosa, but most of the bladder is inflamed actually. But the worst part is this trigone and the opposite wall, this part. So I will put a mark here. Just not to forget which place. Look at the blood vessels. These blood vessels are occurred because of they are fighting against something. There is an inflamed area. So blood vessels, there is formation of new blood vessels. We call it angiogenesis. Okay, we will also treat this area. Here, this is trigone. Let me make a fulguration. Yeah, I can see the depth of abnormal tissues. There are calcifications.
Okay.
Okay, now I'm coagulating the opposite wall, which is also inflamed part, and she is about to wake up. And yes, we can see the opposite wall. We put marks previously, and now we are lucky that her bladder didn't bleed it in the side walls, although it is a little too much vessels. There are too much vessels. Okay, here are some bleedings. That means the bladder is a little inflamed. This is not too much. We usually bleed in the lateral walls. We try to give very low pressure fluid flush. Okay, it didn't bleed too much. I hope it will have a good recovery. And I will try to fulgurate these bleeding parts.
Okay.
We also have some polyps in the entrance of the bladder. These are very commonly seen in the infected bladders. I will try to disappear them like this. can't touch the urethra too much. There's sphincter. And I fulgurated the bladder base trigone like this. We didn't have too much bleedings in the side walls, just a little here, a little petechial bleedings here, and I saw some inflammation in the opposite back wall. We fulgurated that part. The rest of the bladder seems a little too much inflamed, but it didn't bleed it. That's a good sign for a good healing. I hope she will have a fast recovery.
Okay.
Okay, when we look at the vaginal part, there's a little too much discharge. It's not too much important. And this is cervix uterus. It seems quite healthy. There is no need for a gynecological consultation. It looks healthy and yeah, this is posterior fornix. Not too much vaginal discharge. The cervix looks quite good.